wonder why my camera is not working.
Hello.
Anyway.
Good afternoon, everybody, or good morning, depending on where are you connected from. Thank you very much to come to this webinar organized by EUROGI. I am Alejandro Guinea. I am the president of EUROGI, but I'm going to give the floor straight away to Bruce. Bruce is the vice president of EUROGI, and he organized this webinar with Justine. Bruce, whenever you want, the floor is yours. Thank you.
Thank you, Alessandro. Can you hear me?
Yes.
Okay, great. As you might know, I'm the Vice President of EUROGI, and it'll be my honor to facilitate Justine in giving this particular, what I think is a really interesting and important presentation. So, as you can see there, the title is Geohealth in an Age of Digital and Climate Disruptions, and Justine is professor at the University of Twente in the Netherlands. Now, I'm not going to introduce Justine right now. I will ask her to introduce herself as soon as I've finished talking. But just a few housekeeping things. The first one is I understand that this webinar is being recorded, so I think that's fine by everybody. And second thing is, if you do have any questions or comments or anything you'd like to say, please don't hesitate to put them into the chat facility. So those are the only two housekeeping things. If we could just move to the next slide, Alessandro, where I will say something about EUROGI. Now, this is compressed into one slide, so it's going to be very truncated, as we say in English. We were established in 1994, so we are now 31 years old. And interestingly, we were established and facilitated by the European Commission, which saw the need for an organization like EUROGI. And in fact, it provided the first 2 years of funding to enable EUROGI to get off the ground. The mission, as you can see there, is to promote the widespread and effective use of geospatial information, analytics and technologies across Europe. When I say Europe, it's basically the Council of Europe area. It's not just the EU. The membership, now we are an umbrella organization, and that's quite a critical point, with national members who are national GI associations, who themselves have many, many members. We also have public sector bodies, private sector bodies, universities, and NGOs. So because we're an umbrella organization, we only have 21 actual members, but through our members, collectively, we have thousands of people in our network. And quite honestly, if there's anything to do with geospatial in any way, in our network, there will be people who have knowledge and expertise in that particular element of geospatial. What do we do? Obviously, this is an important part. Webinars, for example, the webinar that we've got right now, that we're on. We also run courses, and we've got a course coming up a bit later in the second half of this year, which is on AI and machine learning. And the course will probably be either 3 or 4 modules long, and there will be a small payment to participate in that course. We also give presentations at conferences and different things. We have run an award scheme, and we will be having another one. We do lobbying, and in fact, one of the key targets for us contributing to debate and discussion is with the European Commission. And we obviously do networking because we are a networking organization, and we become involved in projects. Benefits of membership, networking. So if anybody joins EUROGI, you're becoming part of this wider European network, and contacts can be made and are made frequently, pretty much all the time. You can contribute your ideas and your thoughts to whatever lobbying efforts we have. There's opportunities to present your own projects or best practice, and we involved in funded projects. Now, I've given what in English you call a whistle-stop tour of EUROGI, and I think I've used up all the time which I'd like to allocate to saying what is EUROGI. And what I'd like to do now is pass on to Justine. Justine, firstly, could you maybe just give a brief introduction to yourself and then straight into your presentation? Thank you.
Thank you. Hello, everybody. Welcome. Let me just share my slides. Okay, here we go. Can you see that?
Yes.
Okay, great.
It's not on full view, though.
Okay, hold on. Okay.
Yeah. There you are.
Okay, great.
Yep.
Good. Thank you very much for having me here, and hopefully you can all learn something about geohealth and how geospatial information and technologies can be used for different topics of health. I'm Professor of Geohealth at ITC, which is in the Netherlands. For those of you who don't know, we're in Enschede, near the German border, and we have a large contingent of geospatial scientists, just to give you a sense of the different skill sets and knowledge base that we have within ITC, the building here. I'm also program director for one of our master's programs. So if you also have any questions about training or skill sets, I'm happy to talk about those as an aside at another time. I've been doing GIS and health-related things for about 25 years. Started with plant diseases and now do a lot of things related to human health. So about this talk, geohealth, climate change. By 2050, climate change will place immense strain on global healthcare systems, causing 14.5 million deaths and $12.5 trillion in economic losses. That's quite a large number. Hold on, I can't move my slides. There we go. And this is going to affect about 4.5 billion people who will be at high risk to different climate extreme events. Heat is going to be one of the biggest, will have one of the biggest impacts on health in the next decade. And more so, it will affect the younger generation who will have the biggest impacts also in the next 10 to 15 years. So before I get into some of the pieces to think about, I want you to take a moment to think about how a changing climate will affect you and your health. And to give you some prods here, I've put different images on this slide to help you think about that. So thinking about from the food security side of things, thinking about different diseases that you might be exposed to, water quality, air quality, and also how different climates will change and the impacts that they will have. In the last 10 years, one of the biggest impacts that we've seen is in the diagnostic capabilities in the medical field, thanks to the technologies such as machine learning and being able to analyze images in different ways. I'll come back to later to why this is important. But essentially, using the same types of technologies and techniques that we use when we're analyzing, mapping, and extracting information from satellite imagery. So going back to how climate might affect your health, we hear a lot about heat, we hear a lot about flooding, we hear a lot about forest fires and different wildfires and the impacts that those have, not only on heat, but also on air quality and what we breathe. More recently, we've seen new things moving to new places. So here's something that was in the news recently. So sea slugs off the coast of Spain, which sent a young child to hospital. So thinking about the health side of things, are doctors and hospitals equipped for dealing with these unintended consequences of climate change? Lyme disease. We've seen Lyme increasing in different parts of the world. And more recently this summer, we have a celebrity who was infected and also got Lyme. The cost of diagnosed Lyme disease could be nearly about $1 billion annually. That's a huge impact economically, financially, on individuals, but also on the economic burden within countries. In Europe, a little bit closer to home, we have tick-borne encephalitis. Take a look at this map. There are vaccines available. Would you like to know if you should get vaccinated against certain diseases? And if so, what kind of actions do you want to take? So we need centralized and up-to-date data so that we can make accurate risk assessments, and also for individuals to be able to make the necessary decisions that they need so that they can minimize their risks. So these are just some of the things that we're working on. So how can we leverage technology in GIS, particularly in an age of disruptions, which is great on one side, but also for the climate disruptions is not so good on the other side. So for the rest of this talk, I'll introduce a little bit what GeoHealth is about, so that top equation, and then I'm going to pull different examples related to vector-borne diseases, healthcare facilities, and other important infrastructures, and then some of the other work we're doing on climate-related health. Many of you are probably familiar with this dashboard. The technology behind this is created by a GIS company. And this particular dashboard was viewed more than 2.5 billion times during the COVID pandemic. Since then, we've seen an explosion of dashboards to map and monitor different types of diseases. This is important for communication and staying informed on when and where certain diseases are taking place. From the GeoHealth perspective, we live in a complex, dynamically changing environment. So how do we map and model what might be going on with these continual changes? From a technology side of things, we have AI that's also playing a key role in managing, monitoring, analyzing, collating information so that we can connect what's going on in the environment with health. And also through the Internet of Things and the Internet of Behaviors, mapping those and connecting those with lifestyle and individual behavior and how that affects our health. Many of us live in environments where we're constantly exposed to different health risks. In the end, we all want to be healthy and we all want to live in a healthy environment. So how can we make this happen? We can do this by leveraging geospatial information and technologies. So here I capture two things. One is the set of tools that we need. So not only image analysis, spatial analysis, but also thinking about the data science aspects and the citizen science and the social science, because it's through the citizen science and social science that we're able to get deeper information about geographic features and objects, so that we can then start to disaggregate the different drivers and determinants. We also need to look at things across different spatial scales and different temporal scales because of how the environment changes and how we change and move in the environment as well. So taking into consideration the variability and multidimensional aspects of the determinants that influence the outcomes of different health and diseases. The data that we have available is also available at different scales and resolutions, and we need to be able to integrate those pieces. And then we want to be able to predict what might be going on, so going from observations to predictions. And we saw from COVID how something far away can impact us locally. So being able to go across these different scales from local to global and back again. We already live in a highly connected, geo-enabled society. And I've tried to capture that here. So if you get infected with, for example, malaria, and have a blood sample taken, then using those technologies that are now being used for diagnostics, we can look at and determine the parasite load in different blood samples. By using this information, we can then go into the field and take the necessary actions to either reduce the risk, either in the environment or through individuals, by targeting individuals now with vaccines. So having this information at our fingertips allows us to manage, monitor, and reduce risks, both in the environment, but also to the individual. However, getting to that point requires well-structured information, and I'll come back to that. So going back to our equation here, so what does this mean and how can we use this to map and model health in the environment? A lot of this I've summarized in a book that I wrote, which was published last year, but essentially it comes down to three things. So the first part is the agent that intersects with a susceptible host. So you're exposed in an environment. And then we have the additional attributes that contribute to the hazard and exposure. So thinking of the agent again as the hazard, how long you're exposed to that particular circumstance or disease over time, and then also the vulnerabilities and coping capacity. So those vulnerabilities can either be at an individual level, and the coping capacity can be within the community or the individual level. So your ability to go seek medical help, for example. When we think of climate change, we know that there's a lot of different aspects to climate change, and there's a lot of different exposure pathways. And we do know what some of these outcomes are likely to be. For many of these health outcomes and disease outcomes, we know what some of these driving factors are. But it's complex. And this is an example from the World Economic Forum, which I think captures this quite nicely. So here we have different climate hazards. We have different changes in the landscape. We have different health determinants, and then we have a set number of health outcomes. We can have multiple factors that contribute to the same health outcome. The nice thing about a GIS is that we can layer each of these boxes and create a separate layer for each of these. And then we can interact with the information and run different types of analyses and models so that we can try to understand what might be going on at a particular place in time. As I already highlighted, there are multiple drivers, and there's lots of mediating factors and proximate causes. So thinking about the environment, and then going back to thinking about the human host and those behaviors, attitudes, and practices. So thinking of human behavior, and then how that affects different health and disease outcomes. We have a lot of information available thanks to satellite imagery and also the different sensors that are used to capture information. We can extract this and we can look at changes going on in the environment and try to understand how this is affecting different disease and health outcomes. So how does this break down then into mapping and modeling, for example, vector-borne diseases? So over the years, we've done a lot of work on different aspects of vector-borne diseases, and the one that I'll highlight here is related to malaria. Many of you probably know malaria to some extent, or have heard about it, or been exposed to it, or been in environments where malaria may be an issue. 263 million malaria cases occur globally in 2023. Causing 600,000 deaths, predominantly on the African continent, but also in some parts of Latin America and also the Far East. So when we think about mapping and modeling malaria, it isn't just about mapping where malaria is, but it's also thinking about what I have here, the life cycle of malaria. So malaria is actually composed of 4 parts. So the first part here is about the mosquito. So thinking about the drivers that affect the population of the mosquito. The second part is thinking about the parasite inside the mosquito. So once the mosquito acquires the parasite from a human host, then the time frame it takes from the time of acquisition till the time it can retransmit it again. The third part is once the human is infected with malaria and how long it takes to go through these different stages and then is reacquired by the mosquito. And then the fourth part is the exposure environment. So this is where the transmission happens between the mosquito, which acts as a vector for malaria, with the human host. And there are many different things that can come into this aspect of mapping and modeling. So I'll break this down. So if we have clinical information about malaria, we can map where malaria is distributed. And we can use a variety of spatial analysis methods or even data mining methods so that we can look to see if it's occurring in the same place at the same time, where is it most prevalent, where is it least prevalent, where there are hotspots or not. And I'll come back to some of this with an example. If we don't have malaria case data, but we do know how it operates in the environment and what the drivers are based on temperature and rainfall, as I've shown on the left side here, we can then map and model potential risk. And we can do this with whatever climate information we have. So we can look at this at a weekly level, we can look at this at an annual level, We can look at this at a monthly level. And then we can see how this varies from year to year. And here are some of the examples that we've used. Depending on the information that we have and the modeling capabilities of an individual, we can create maps that are computationally quite complex to put together, or we can use more standard spatial analysis methods such as suitability analysis, where we break down this information. So how can we use these to examine changing malaria trends? So one of the examples here that I highlight, it looks quite complex, is that we took 20 years of malaria information that's globally available through the Malaria Atlas project, and we looked at how malaria has changed and the distribution of malaria has changed in Kenya, for example. So we extracted information from 2000 to 2020, and then we analyzed this in 3 ways. One is that we looked at the complete data set to see how malaria has changed and to see what kind of trends were taking place, whether they were increasing or decreasing in different parts. We also then broke it down by decade, so between 2000 and 2009 and between 2010 and 2019. So again, so we could see if there was any variations. So I'm just going to show this one example. So as you can see from 2000 to 2020, that there are certain areas where there are clear hotspots, so the high clusters. There are other areas where the distribution oscillates. So those are the lighter pink areas where some years there are high malaria incidence and other years where there's lower malaria incidence. And then when we looked at this by decade, we also see that there's some variations going on. So in between 2010 to 2019, we can see that in certain areas, malaria increased in its spatial distribution compared to what happened in the previous decade. So we can also then pull out information for each of these hotspots so we can see what might have been going on a year-to-year basis. So if we look at the hotspot HH3, we can see actually that it decreased quite quickly in between 2000 and 2001 and remained, malaria cases remained fairly low, but it was prevalent. And then something happened in 2014, and then we see that there's been an increase up until which peaked in 2017, 2018. So there's lots of different reasons why this might happen, but using these kinds of methods allows us to dig a little bit deeper so that we can try to understand and see what kind of changes are taking place. And then based on that, we can then start to think about what kind of response might be needed. Do we need to use more bed nets? Is there sufficient bed net use in an area, or do we need to take other actions, for example? We can also combine these results with other information that we might have. So from work that I did previously, looking at mobility and cross-border mobility, where this information came from movement from people tweeting. So when people cross borders and use social media, they don't change their user ID. So if you can get that information, then you can tie where somebody has been. So using mobility information, we can, and then also using the Malaria Atlas project information as a background source, we can then start to see where potential malaria sources are coming from and where those flow of the parasites might be taking place into some of these hotspot areas that we had previously identified. So if you notice that many of the hotspots in Kenya are along the borders of Kenya with, particularly with Uganda, but also along the coastal areas, particularly in the south with Tanzania. So knowing this information, we can then start to think about what kind of response might be needed in different areas. Going back to the climate aspect of malaria, so that example I just showed you is dealing with known malaria cases. But also, if we don't have malaria information, case information, we can still map and model malaria risk. And I'll just explain briefly why that we can do this. In a lot of laboratory experiments, they look at how quickly mosquitoes get infected once they acquire the parasite and how quickly the parasite develops inside the mosquito at different temperatures. Based on that, we can create a model that represents the thermal biological limits and that interaction between the mosquito and the parasite, and when the mosquito can start vectoring the parasite. And that's usually when the risk happens. So what does this mean? For example, Kericho, which is a high elevation location in Kenya, and the temperatures range from 10 to maybe about 15, 17 degrees. So what does this mean for parasite development? Essentially, there are short windows during the day that the parasite can grow, and eventually this will become transmittable in about 10 to 15 days at cooler temperatures. But because of this window, even at high elevations, malaria is still possible. If we look at low elevations, such as Kisumu, where it is a lot warmer than in Kericho, we can see that actually the parasite can develop within 24 hours of the day, even though in the early mornings the temperatures might be cooler, so that development will happen at a slower at a slower rate. Based on this information, we can then create a model that then allows us to look at what that risk is based on these types of parameters. We can look at this on a monthly basis. So here are some maps that highlight how that risk changes on a month-to-month basis and also between years. And then we can look at this further to see if the same place has the same risk over time or whether in some places this oscillates. And we can see that a little bit with the hotspot analysis we did, where there were some areas where the malaria prevalence or the malaria cases varied from high incidence and low incidence. So this might be some of the reasons why. Obviously, we need to look at this further, but this gives you some idea on how variation can take place. Managing vector-borne diseases are complex, and try to capture it here. We have the tools available with the different data science, spatial analysis, image analysis, and also the social science toolbox, as well as extensive domain knowledge. We need to be able to integrate these, and some places are doing this so that they can take action against the vector or the parasite through humans with antimalarials or now vaccinations. But again, we need this not just for malaria, but we need this for other diseases. And this leads me to some research that we have a PhD student working on in Kenya, working on a slightly different system and looking at ticks and mapping tick distribution so that we can build awareness of diseases associated with ticks in Kenya. So again, taking something similar to what the Malaria Atlas project did, developing those maps, but at a more local level for ticks. So I highlighted a little bit about diseases, but if we're also going to combat diseases, we need to think about infrastructure and thinking about access to infrastructure and particularly health facilities. So we've also done a varied amount of work, and this is just a summary of some of the things we've done, and I will just talk a little bit about, since this talk is about climate, to think about the climate effects and how that can affect health access. For this, we need to think about what services are needed, what health centers, what is available, and where health centers are located, but also how people are getting to these different facilities. Are they walking? Are they going by bike? So here in the Netherlands, the mode of transportation by bike is very popular. So should we be considering these? And then also, so thinking about the feasibility, and then now also there's a lot of work being done with drones and delivery of certain medicines. So how can we take this into consideration when thinking about accessibility? Timely access to health treatments for diagnosis and prevention matters. There's been some work done previously that shows that hospitalization of malaria incidents may double when there's more than 2 hours distance from health prevention areas, and same with mortality will double when you're further than 4 hours away. There's also different criteria for examining accessibility to health. So if you think of defibrillators, actually the criteria time for that is less than 6 minutes. For hospital emergencies, less than 30 minutes. And this can also vary depending on if you're living in an area with snake bite and getting access to antivenom in a timely manner. So there are different things to consider. One of the things that we have looked at is looking at variation in accessibility at different times of the year, and how for example, wet season might impact access to certain health facilities, particularly in areas where the main way of transportation is by walking. So by combining different information and modeling accessibility, we can then look at and get a sense of what type of access is viable in different areas, and also how that might change. This isn't only applicable for health facilities, but also access to water and sanitation, which plays a major role in reducing transmission of different diseases. We saw this through COVID. So ensuring that these types of facilities are also readily available is very important. Okay, climate. Climate and health. Here's an example of different flood events that take place around the world. We talked a little bit about vector-borne diseases. So here I've highlighted some of the different vector-borne diseases in those areas. By using some of the climate-based models that I highlighted earlier, you can also apply these to these different areas to examine what the risk of West Nile virus would be, or dengue, or Rift Valley fever, because the models are available, and then you can combine this with climate information and then already assess what the risks are likely to be should a flood event happen at a particular time of year. So as I highlighted, there's lots of ecological factors. So by bringing these pieces together as I showed you with the malaria example, we can then start to see what the risks are for different diseases. In the case of disasters, particularly climate-related disasters, because you're bringing together the agent with a potential susceptible host, or a host that might be infected with one of the diseases, due to these disruptions in bringing these pieces together, you will likely see these different diseases becoming more prevalent. So essentially, accelerating health outcomes. Time matters because of the incubation period. So when an event happens, you'll see a lot of cases. So in the red here, you'll see a lot of cases happening in the short term. And then the diseases that have longer incubation time will start to appear in the yellow, and then the other diseases that have more delayed effects will start to become more prevalent later on. So essentially, this is capturing that vulnerability and the exposure and the coping capacity within a system. So what does this look like over time? You have the traumatic injuries that happen first, followed by respiratory illnesses, waterborne diseases, diseases that require direct contact. So if you think of COVID, and then you have the vector-borne diseases that start within 4 to 6 days from time of infection. And then the mental health aspects can start earlier, but sometimes they have delayed effects. So that's why I put them a little bit later. But essentially, all of these different diseases have particular incubation times, so then you can start to understand when they might start to occur when an event happens. So we've been looking at different aspects of this based on events, and in particular heat and flooding. So let me I have a few examples. So flooding. In Germany in 2021, there was a big flood event. The Copernicus Emergency Management Services mapping service had satellite imagery, and then they extracted information about the flood event, as you can see here, and then classified the extent of the flood, but also what houses and buildings might have been damaged, destroyed, or possibly damaged. So we have a PhD student who is looking at the effects, the social and mental effects of floods in vulnerable populations, such as older adults. So we used the Copernicus information to think about the sampling that we were going to do, what areas to target, and to think about who in there might have been affected based on this information. And we are looking at the mental health risks and the social health risks as summarized here. We also had a master's student who looked at leptospirosis, which starts to occur after flood events as you get in contact with contaminated water. And in this case, we looked at two things. We looked at the effects and where leptospirosis occurred at different time points. So before a flood event, during a flood event, and after a flood event, and then looked to see where areas were most prevalent and how they related to a particular flood event. This again can also be used to understand where leptospirosis is distributed and who got in contact with the water, contaminated water, and how far reaching that might be. And also if there are outliers, to try and understand what the link is with those outlier locations with the flood locations. And then finally, heat and health. This is a big topic now as our temperatures are rising. So, but to be able to understand what is going on, we need to look at different characteristics. And here's an example from a student who did her master's and is now continuing this work as PhD to look at what different heat characteristics are taking place where, because by understanding these different characteristics, then we can think about what kind of actions and warnings might be needed in different places. More recently, another master's student looked at trying to predict indoor temperatures, so extracting information from satellite imagery, so roof types, and then based on those roof types, thinking about what the indoor temperatures would be based on different roof types, the indoor temperature inside the house will be affected differently. And then how do we think about health vulnerabilities in areas where we oscillate between heat risk and flood risk? Because those coping strategies that need to be put in place there are quite different when dealing with flood and dealing with heat risk. So thinking about what the health vulnerabilities in those environments is also some work that we've had a master's student working on. So in essence, climate can affect health in many different ways. We can see increased health effects, we can see increased distress reactions, and there can be long-term health effects. So that's affecting the individual, but it can also affect the community and impact the environment. So thinking of financial burdens, the infrastructures that need to be put in place or to be fixed, and also in some cases, it can lead to breakup of communities. So in areas that have been flooded, you have evacuations, and sometimes people don't return to the communities. So in a nutshell, we can map and model different aspects of geohealth based on that equation to look at it, to look at different diseases. I've only highlighted a few here, but but by capturing the ecology aspects of things, we can then start to map and model whether it's planetary health, global health, disaster health, climate health, because they're all, as long as we know and understand what the drivers are, then we can start to better assess what the risks and outcomes will be. So essentially, we use an integrated geospatial approach to understand disease prevalence, risks, and outcomes. And we use the different tool sets because GIS and geospatial is very technology, has a base that's very technology based that allows us to create models as well so that we can put together the necessary pieces. We need to be able to understand the ecology of the disease, but also think about how we're going to respond. And as I highlighted with the example of COVID, we need to think about the communication. What do we communicate so as to inform individuals so that they can take the necessary actions to minimize their risks? So climate and changes in climate can affect our health in many different ways in the short term and long term. And geospatial technologies can help us reduce future risks and enable rapid and real-time responses. But to do that, we need integrated systems. GIS, Earth observation, and AI are transforming our understanding and response to global health challenges. They can advance our understanding of those complex interactions between the environment and the health and well-being of varied and different populations. And then we can reduce health risks through integrated systems by monitoring and managing both current and future risks. But we should also not forget that it also allows us to evaluate the past. Our goal is really to think about one planet, one health in real time, and we can do this with the different technologies. And essentially, this can help us make informed public health decisions. And that's it. Thank you.
Thank you very much, Justine. I think it's been an excellent presentation, really great slides, and very presented in a measured, clear kind of way. So congratulations from me, and I'm sure many, many, or if not all, of the others who've been participating. Well done.
Thank you.
A thought that absolutely comes to my mind when listening to you is the absolute centrality of location. I mean, it's a key piece of the jigsaw puzzle, and I had in front of my mind a jigsaw, and right in the center of the jigsaw piece, location. And your presentation has really highlighted that point so clearly. Before I hand over to any comments or queries from anybody else, I'd just like to myself, because I'm running this, to say, could you speak a little bit more about digital twins and how they are being used, in what way to deal with health kind of and climate matters?
Yes, so essentially digital twin is replicating in the digital environment what's going on the ground. So in climate related things, so that varies a little bit depending on location, but essentially we now have access to climate information at a global scale. It's at a monthly resolution, so that makes it easier to start exploring. We also have available a variety of satellite imagery that is collecting information daily, and there are data sets that are created that highlight the daily temperature information. Not all of it is seamless, and some of it needs quite a bit of processing, but essentially a lot of those pieces are there. We just need to be able to put it together more comprehensively so that it's more standardized. So there's still a lot of work ahead. But at a more local level, a lot of that information is more readily available. Does that answer your question?
Yep. Okay. Thanks very much, Justine. I'd like to open it up for questions or comments from anybody else. I think probably the best thing is you put your hand up. Is there anybody? Alessandro, can you see anyone?
No comments in the chat and no comments in questions and answers.
Okay, maybe then I could just come back with another question or comment. Would you mind just elaborating on how AI or machine learning is impacting on the work that you do in understanding climate health relationships?
Yes, so it's helping in different ways. So firstly, it's useful for extracting information. So extracting information from satellite imagery so that we can then start to pull together different pieces. The other way is, so for the example with the tick information, some of that work is also AI is being used to for tick identification, so that we can then, because if we have pictures of where ticks are located, then we can start to map out the spatial distribution of where a particular species is occurring. So that's in development. The other way is just mining through large data sets. So from the climate aspect, being able to put together the information, climate, and then look at different patterns in the data, so that we can find areas that are more similar or less similar. You can do that with species niche modeling, but also or adapt your own algorithms to do that. Some other things that aren't really related to climate aspects, but is using the large language models to pull out sentiment from text that people might have put in social media, so that we can get a sense of people's perceptions and sentiment about certain topics. So again, mining through different types of information related to that, and then mapping that out. So AI is for data extraction, data organization, and then also looking and putting it through different models so that we can predict more accurately, for example, and identify different species and things.
Okay, thanks. Just, I see we've got 4 minutes left before closing. Just another question or thought that came to my mind is...
sorry, Bruce, there is a question in the chat.
Oh.
Do I read it?
Yeah, just read it.
What is your opinion about the reliability of epidemiological data sources? I live in Latin America, where data is often scarce, and this represents a major challenge for mapping and modeling.
Yes, that really depends what you're trying to map and model. So as I highlighted, so one of the things that or I encourage is also to think about the ecological factors, because if you have diseases, for example, like with malaria or other vector-borne diseases, a lot of the factors driving those are environmental. And that information is more easily and readily available, because you can get that from the satellite information or from extensive meteorological networks. So those types of information you can get. For some of the other epidemiological data, so case information on certain diseases, that is difficult anywhere you go. And actually then in that case, if you're looking at something, then set up a citizen science and get people to answer certain questions and build your own data set. I hope that answers your question.
Yeah, I hope so. Thanks very much. You mentioned citizen science, and in the last minute or two that we've got, I was going to ask you about the role of citizen science in the work that you do.
Yeah, so citizen science plays different roles. So for example, if you think of OpenStreetMap, that's a fantastic data source that's base information. And for example, getting health facilities locations, you can extract a lot of that from OpenStreetMap, for example. So there's a lot of, and also if you check out Humanitarian Data Exchange, a lot of people put information on there and share information. For citizen science, yeah, if there's particular information that you need about something, then you can set up your own citizen science collection tool to get that information. It's a great way to get insights about different things that might be going on, and in some cases a lot cheaper because data collection is quite expensive.
Okay, thanks very much.
But be careful, because sometimes people will put rubbish into, so you have to also be very careful about that.
Okay,
There's another question.
There's another comment coming in here. Madam, Professor, Madam, since reliable epidemiological data is hard to find in many parts of Pakistan, how can we still conduct accurate disease mapping and modeling?
Same as what I mentioned for Eliana in Latin America. Yeah, this is not only in Pakistan. I mean, we also have difficulty accessing health data in many parts of the world. Like I said, if you have the ecological understanding, so depending on what disease, then you can already start to explore by using environmental information. Otherwise, same thing, start collecting information through citizen science or mapping it out yourself.
Okay, thank you very much. There's another comment coming in here. Hi, Sita from Mellon Technology. One question. Are there any examples where digital tools combining EO and health data have been used to shape policy or guide health interventions? So wanting to know about the impact of all of this stuff in creating better outcomes, better health outcomes.
Yeah, so I can think of an older example. So one of the first malaria maps was used to think of bed net distribution in Africa. So yeah, so some of these, and then also with targeted, with the polio information, extracting and finding particular households that might not have been visible, so that they can target different polio vaccination. They used Earth observation to identify remote settlements and things. Yeah.
Okay, I see we're 2 minutes over, but if there is any last comment anybody would like to make, yeah, thanks, one's come in. Thanks, Justine. Great use of location intelligence. Sorry, who's this from? Harry. For those struggling to source data, the Living Atlas may be a good source. And then Harry puts a link to the Living Atlas.
Yeah, for anyone who also has ArcGIS Pro, check out the data portals where a lot of people also put data sets, and there's a lot of satellite imagery and Earth observation data accessible through there as well.
Great, thanks. There's a last comment, Francesca. Great webinar. Thanks, Justine and EUROGI. I need to disconnect. Wish you a nice afternoon. Thanks, Francesca. Yeah, we're now 3 minutes over. So I think I'd just like to ask Alessandro, are there any last comments you would like to make?
No, from my side. Thank you very much. We can close now.
Sorry, just one point, Alessandra. The recording will be available where? On our website?
Yes.
Sort of from tomorrow or whenever?
I don't know, maybe a bit later, but yes, in short term, I think you will receive a link from Teams, and after that, we will upload it to the website. Yes.
Right.
Thank you very much. And thank you very much, Justine.
Thank you.
Very
Thank
interesting.
you, Justine.
Thank
Bye.
you.
Bye-bye.